Good afternoon, everyone. I think we'll start with the numbers for today. So at this point, we do have 14,117 cases recorded in Ohio. That is 87 of our 88 counties. 54 of our counties have had at least one death, and we are now reporting 610 deaths in the state of Ohio. Other than that, on our next slide, we see that our numbers stay roughly the same, although we're seeing, and I've seen this for 2 days in a row, a slight skew toward the male in cases, which will be an interesting thing to follow. We've done 97, almost 98,000 tests in the state of Ohio, and we continue to see the same age range. Next slide. Similarly, our trends are continuing, but we did see in the last 24 hours a dip in our cases to 392. Again, we're following our 5-day trend lines. Similarly, we've gone up a little bit on our deaths. We know that our deaths are lagging behind our illnesses, so that is not as surprising. We're also seeing an increase in our ICU admissions. Next slide. So this is something that I just wanted to explain in more depth. We're really excited yesterday to announce the governor has asked and paired with, and I have to say personally, it's an honor to have been on the phone with 3 governors at once, Governor Celeste and Governor Taft, and of course, Governor DeWine. But we've really put together a team of people, the way the governor said, and Lieutenant Governor, that, you know, we're not sitting back idly. We really are trying to make, and have been making all along, you know, the most aggressive moves we can in dealing with this global pandemic. And so one of the things we're doing is trying, first of all, to maximize who we test so we can make the most of the testing we have. And then a team is endlessly working 24/7 to try to find the ability to scale up our testing. We all know by now how absolutely important testing is as we try to move forward, our ability to put out those hot spots as they have, to identify people, and more so people with mild forms of illness. If you think about it, if we can find people when they're mildly ill, you know, right now we're seeing people mostly by the time they need hospitalization. If we can catch you earlier when you're mildly ill, and follow you and the people that you have been in contact with more carefully, more accurately, not only will we decrease the spread of the virus, but we'll also be watching you and checking in with you and seeing if you're taking any turns for the worse. Our biggest thought is how can we prevent people from taking that usually week 2 turn for the worse. We really see people, interestingly, the science is showing, that are walking around. They walk into emergency rooms, Governor, and it's not till they put the pulse oximeter on. It's that little machine, you know, that goes on your finger and lets you know how much oxygen you have in your blood. Usually they are seeing levels of oxygen so low that you would typically be intubated by the time you had that level of oxygen. But people are actually, because of the unique way this is affecting oxygenation in the body, people can be almost like a walking pneumonia. They're walking around not knowing. So there's a lot we're learning about the virus, and we're really trying with our future testing to be even more clever in how we really come around people who have this disease. So important for everyone to know, and I say this to all hospitals, all clinicians out there in the state, we've always been prioritizing who we test, but it's very important, and I'm insisting on this, that we all prioritize the same way. We have a limited amount of testing, and we always want to do by these tiers, and these tiers are going out, once again, to all providers. We've made some adjustments because we think we have enough testing to expand slightly who is in the groups. So priority 1 is always people who have symptoms and who are either hospitalized or healthcare workers. Priority 2 has been individuals with symptoms who are living in long-term care congregate settings. These also include any of our congregate settings, whether they be prisoners. You mentioned we do have a first case in a juvenile prison. We are looking around at psychiatric hospitals, assisted living, any place that people are living together. And our first responders and our critical infrastructure workers are also in this tier 2. People who are 65 and older because they're very high risk, and all of those with underlying complicated medical conditions. We have a 2A priority, and these are for individuals and staff who are without symptoms but are being exposed in a high-risk situation. So this included some of our, in the prisons when we extended our testing, we saw that people were asymptomatic. So we're being able to further out those groups, and we'll be doing the same thing in nursing homes. And then priority 3 is other individuals with symptoms who are more mild, but are in areas, in communities in which we see one of these hot spots. So little by little, we're trying to get out farther and farther with our nets of testing. So again, I really appreciate our hospitals. They have taken on being not only about what is in their walls, but their extramural. They are taking on their communities as their hospital, and they're working in partnership with all their community organizations and with their local health departments. Right now, as we speak, we're using our zone plus region approach. We have one case, and in that case, an outstanding local public health department is doing all the epidemiologic disease detective investigation. Our hospitals are working close in hand. Our testing is working. We're making sure the right PPE is there, making sure all the best practices are done. And as we little by little turn that dial and open up some of the things that we can do, whether we see an outbreak in a business or in a community, ultimately someday in a school, we will use those same principles to surround that. Similarly, our contact tracing, our talks, we had a wonderful talk with Partners in Health yesterday, Governor. We're very excited about the workforce we're going to be building of both traditional public health epidemiologists, but also community health workers who we have used in other contexts, people from the community who can reach into the community and help us all through this difficult time. As the governor said, we have also are making a change in an order on how our hospitals are working. This is not an extensive change in order. We are still very much in the process of working with the hospitals and with all sorts of private providers out in the community. So that work is still ongoing. Similarly to business, we're looking at what are the lowest risk healthcare things we can be doing to the highest risk. And we'll be doing that in every industry as we gradually return and try to learn to live with the virus. But one of the things we've noticed, and it's very disturbing to me as a physician, it's very disturbing to the governor, to learn about situations in which, you know, there are people who have had some symptoms that I do not think are non-essential. It's really important that our clinicians reevaluate that, and to that extent, I'm putting some clarifications into an order. There are some people, we call this foregone care. There were people who are first in line to have some diagnostic procedures and some procedures that are really needed. It's been a while now, over a month, that we have postponed certain procedures for very vulnerable and complex situations, so we'll be addressing that in the order. But we have a lot more work we're doing in partnership with providers all over and with hospitals on how we'll be eventually doing more and more. But as a very slight tweak to the order we have done, we will be clarifying that order. It's really, really important. And if you're at home and if you're having a change in your clinical condition, please reach out to your doctor. And doctors, if you have questions about that guidance, please do reach out. You know, coronavirus.ohio.gov. We still have our hotline, always behind us on the screen. And I want you to use that and ask the questions you need to ask. I don't want anyone out there should not be suffering or having a worsening condition and not have that condition reevaluated. I really want to do a shout out to our federally qualified health centers. There are a number of free clinics in addition. People are really stepping up. If you are not finding care and you're out there, go to your emergency room if you have no other provider. Really, nobody should be left suffering. And I have just found a few stories I've heard of people being denied care, just unacceptable. So please, that is what my new order is about. Two other things to quickly show, Governor. I do believe we have a video to show. So we can go ahead. Eric? To preamble it, Eric, I'll just say, this is a video that was made by our team at ODH and the governor's team to show, again, as we move forward, I've heard people talk about stay at home, and we're saying still safer at home. You know, as we move into the world, home is still our place. We'll start again, I'm so sorry. And I really want you to know that this video has gone viral all over the world. It's been requested by people all over the world. States are starting to use it to show, again, the impact of our social distancing.
How many fingers were snapped in the filming?
I know. There's been some fun articles. I don't know if you could hear the volume at home. If you couldn't, I couldn't hear it here. So you can go to our website to see it. It took me 2 times seeing it to fully experience the effect of it. But it's clever. It was done by a company in the Dayton region. So it's a local Ohio group. And you know, it's an exceptional, talented thing, and we're going to be doing more of these because we know we really need to get the word out, and we're working with fellow states. One last thing. I don't know, Eric, if you can pan in, but I've had the blessing during this time to receive a lot of artwork. This here is from Seth and Dahlia, mommy and daddy as well. This was one of my favorites I just received. Eric, I don't know if you could see it. I'm getting a lot of like cartoon coronaviruses with little anti-signs. So to this extent, our emergency operating system, a center lives in a place without a lot of windows and light. We've been working for a couple months straight. So on our website, for you at home and for all the young people at home, we have a way you can send us your artwork. You can mail it to us or you can email it to us. And I'll take adult artwork as well. We have some pretty boring walls at the Ohio Department of Health, and we've been wanting to display people's artwork. So I see there's so much going on during this time. Art is really a tremendous way to express and say more than we can often say in words. And whether it's how our kids are experiencing the situation or how you are experiencing it, we'd love to receive that. Coronavirus.ohio.gov. We'd love to see what you're creating. Thank you.